Hello, my name is Dr. John Glen, and this is the first video in a series that CIPS are going to produce in order to examine the economic consequences of our response to the coronavirus pandemic. The initial response to the pandemic was to try and reduce the surge in the number of citizens contracting the virus. In doing so, we were hoping that we would reduce those numbers to a level where individuals needing intensive hospital care could be supported through the period of illness. What we then needed to do after a period of 8 to 12 weeks was to start to open our economy up. And in the words of Dr. Mike Ryan at the WHO, start the second phase of the battle, which is taking the war to the virus. What we now need to examine is what are the economic consequences of both stages of that battle. In the first instance, I'm going to look at the first 3 months of the battle against the virus and the impact that that's had on our economy. Many of us now find ourselves in economies where in the initial stages of that fight against the virus, we've seen a lockdown of our economies. People have been put on part-time work. They're working from home. In some instances, workers have been furloughed. So essentially, they're not doing any work, but they're not being made redundant. And in some instances, governments are providing support for those furloughed workers. But in the extremis, we've seen a significant increase in unemployment, perhaps illustrated most starkly by 10 million workers registering unemployed in the United States in the last 2 weeks. The consequence of this is that if we look at national output on an annualized basis, March 2019 to March 2020, many of our economies have experienced reductions in output in excess of 25 to 30%. These figures are truly alarming and have led to a fall in income, a fall in employment, a fall in national output. The policy response of many governments in the first instance has been to try and support household incomes and to try and provide support to businesses to see them through that first 3 months of the crisis. So in the United Kingdom, for example, our government has announced a furloughing policy whereby the government will pay 80% of the wages of employees up to a maximum of £2,500 a month for 3 months. But these policies are incredibly expensive. That policy alone in the United Kingdom could cost upwards of £10 billion for the first 3 months of the policy. In Malaysia, for example, the government has introduced a payment of 600 ringgits, £100 per month. And this belies the issue that we face as a global economy. Poorer economies do not have the ability to sustain both their households and their businesses through the crisis in the way that rich economies do. But in the same way as we have to take the fight to the virus in terms of health as a global strategy, we also have to develop economic strategies on a global basis to get our global economy past the crisis that we're facing at the moment. That means it has to be a global solution. We have to look to support those economies who are not as wealthy as ours. It is not a situation where one economy wins and another economy loses. This is a global fight against the virus. It is a global fight to sustain our economy. We will win this fight together, or we will lose this fight together.